So now we're moving into the sunshine vitamin so this is our micronutrient component with Dr. Keara Taylor. Give a wave, Dr. Keara.
Hello.
And Dr. Keara is a naturopathic doctor here at Higher Health. And this vitamin was top of our list for what we had to touch on first. So last week was magnesium, and today is vitamin D3. Go ahead, take it away, Keara.
Okay, so hope you're all, I'm feeling like so relaxed right now after that beautiful sun salutation start. So I'm super excited to be chatting with all of you today about vitamin D, our sunshine vitamin. So it's a really, really interesting nutrient because it actually acts in the body more like a steroid hormone. So most of our cells and tissues in the body have vitamin D receptors. So what that means is that, like a hormone, when vitamin D attaches to a receptor, it's going to cause an action in that cell or tissue. And because so many of our cells and tissues have this receptor, it really affects so many processes and systems in our body. There's so many issues, you know, that are top of mind for us as women and things that we face. Vitamin D can benefit. So I'm really excited to kind of highlight a bunch of those benefits that vitamin D has for you. And then we'll dive a bit deeper into, you know, forms of vitamin D, dose, things like that. What else is exciting is that vitamin D, like the research on it is so robust and it's just increasing at such a great rate. So it's really fascinating to kind of follow that in the literature. So I wanted to start with something that's kind of just top of mind for all of us right now, keeping our immune system strong. So, you know, we really want to, a lot of us are just thinking like, how can we keep that immune system robust and resilient? And we know that vitamin D does play a role in our immunity. So it actually helps to, so having adequate vitamin D levels helps to minimize the chance of infection. And it also helps to decrease the severity. So like how many symptoms you have and the length of like colds and flus and things like that. It also plays a role in autoimmunity. So if you are someone who tends to have, like, if you have an autoimmune condition or you tend to an autoimmune flare or something like that, vitamin D is going to be an important nutrient for you. And then let's chat about hormones. So us as women, like hormones, you know, top of mind for us. And vitamin D actually helps it has an influence on the production of estrogen and progesterone in our body. When we have a deficiency of vitamin D, it is linked with things like amenorrhea and oligoamenorrhea. So those are when we have no menstrual period or a really prolonged or irregular menstrual period. So it really helps with healthy ovulation, so maintaining a healthy ovulation and a regular cycle each month. But even diving into more like specifics, that things that like us as women face, so things like PCOS, so polycystic ovarian syndrome, is something that a lot of women experience this. If you don't, you know, you might know someone who does. And we know that with PCOS, a huge part of that is it's a metabolic condition. So we have issues with insulin and insulin sensitization. And just a quick kind of recap of that is that, you know, when we eat foods that have sugar and carbohydrates, they break down to glucose in the blood, and then insulin is released from the pancreas to help cells to uptake that the glucose. So if our blood glucose gets too long, if it's high, for too long of a time, that can lead to effects later on down the line. So what's really interesting about vitamin D is that it actually works at that insulin receptor site. So it helps the cells to be more sensitive to insulin. So this is going to be important in something like PCOS. So we actually see that women with PCOS tend to have lower levels of vitamin D. And then also beyond that, obviously, just in, you know, a lot of people now do have issues with insulin sensitization and things like prediabetes and things like that. So it's something that's important in that regard. And then also with hormones, thinking about things like period cramps, PMS, you know, things like women, we kind of, you know, a lot of us experience things like this month after month. So we actually see that vitamin D helps to reduce the symptoms of PMS and period pain and things like that. So it's a pretty cool nutrient from a female health perspective, from a hormone balance perspective. With fertility, it also becomes really important. So again, I mentioned the regular ovulation. the production of progesterone and estrogen. So we know that obviously for fertility, we want to have a healthy ovulation. And then also vitamin D is actually associated with AMH, which is like an ovarian marker. So sometimes we'll look at that in fertility. So, you know, from a women's health perspective, it's so important, but I also want to touch on the other kind of things that we as women are really concerned about. So things like bone health, heart health, you know, like as we age, we really need to think about things like that. So from a bone health perspective, now this is, I think, really what a lot of people know vitamin D for, right? So the vitamin D plays a huge role in absorbing calcium and phosphorus from our gut, like from our foods and our digestive tract, and then it helps with bone mineralization. So it helps to strengthen that bone and make that bony matrix. And so as women, you know, when we reach like that, those post-menopause years, our risks of osteoporosis and fractures and things like that do increase. So it's all about, you know, as naturopaths, we're very much all about holistic medicine. So nutrients and things like that play a role, obviously exercise and all that kind of stuff, but we want to be, it's something we want to think about, right? Like our whole life, we want to think about optimizing that bone health. So vitamin D is a really important nutrient for that. And then as well, I mentioned cardiovascular disease or heart health. We know that a lot of tissues in the heart actually contain vitamin D, have the vitamin D receptors. So, and it's actually vitamin D is linked to a reduced chance of cardiovascular events. So as women, you know, we do have a risk of vitamin D, or sorry, our risk of cardiovascular events increases post-menopause. So that is something that just like throughout our life, we want to make sure that we're keeping that in mind. And then of course, you know, with the sunshine vitamin, like, I mean, Dr. Keara mentioned yesterday, it was sunny. I think if you like went outside, you would have seen everyone like ripping off their shirts, like people were in shorts and t-shirts. And like the sun comes out and we think joy, happy, energy, light. Vitamin D is definitely linked to mood. So things like, you know, especially here in the Northern Hemisphere, when we spend so much of our year in the darkness, and a lot of us can have something called seasonal affective disorder. So that low mood that happens in those gray days. And we know vitamin D helps with that, but even with just depression symptoms in general, vitamin D supplementation has been shown to help with that too. So I think it's really fascinating, I guess, like how many benefits there are, how many parts of the body are influenced by vitamin D. So I think that it is such a cool like nutrient from that perspective. So how do we get vitamin D? So we know that there's two forms of it. So there's D3 and there's D2. D3 would be the more like potent form of vitamin D. So that's one that can really raise our blood levels. And that's the one that we get in the sun. So when we go outside, we have bare skin, the UVB rays react with the skin, and that produces that D3 in us. You know, sources kind of say anywhere from 10 to like 20 minutes of bare skin exposure most days of the week, a couple of days of the week might get you to those levels that are needed. But there's a couple factors to keep in mind. So like skin color, ethnicity, genetics definitely plays a role in how much vitamin D you need. And then of course, we're always balancing our skin cancer risk. So whether you're like how much time you're actually spending outdoors with your skin exposed. And then, like I mentioned, in our country, like we're spending so much of the year not able to be outside with like our skin exposed. It'd be amazing if we could, but we can't always. So there are a couple food sources of D3. So things like fish and eggs. And then D2 is another form of D, but it doesn't raise our blood levels as much, so it's not as potent. And that one is from plant foods, so things like mushrooms and fortified foods. But honestly, like you're probably not getting enough through food. So this is something that a lot of people do find benefit from supplementing. So there are ways to get it outside of supplements, but it's a lot harder to get enough. And that kind of begs the question, like, how much vitamin D should we take? And so right now, the RDA, so the recommended dietary allowance is set at about 800 IUs per day for adults. And that's really to prevent something called rickets. So that's like a deficiency of vitamin D and calcium, and it's really like brittle bones. So that's kind of, you know, why we're talking about vitamin D and bone health. But a lot of we want to make sure that we're at, we're naturopaths, we want to be at the optimal level. We're really talking about like optimal health. So the best way, like usually what we would recommend, is to get your blood levels done and to really base your dose based on your blood levels, because we want to get you to that optimum level. So it will vary from person to person. So as an example, I think a lot of people will recommend, and sources and things like that will say 1,000 to 2,000 IUs. And again, like that might be enough to maintain. If you have good levels, it could be enough to maintain it. You have to balance that with your skin exposure. And then keep in mind the time of year. So that's why working with your ND is really great, to just make sure, because sometimes you'll need to change your dose like throughout the year as well. So working with an ND is great for that. I know that people, so also like so if we are going to supplement, so a lot of people, a lot of us probably will need to supplement, especially here in the Northern Hemisphere, because we're not getting that exposure to sun. So what we really love, the best forms of vitamin D would be one that's emulsified in fat. So that really helps with the absorption. Because it's fat soluble. So I just did want to make a note about the dose, because we do want to make sure that we take enough to get to that optimal level, but also because it is a fat soluble vitamin, that it does kind of stay around in the tissue. So it's not flushed out like B vitamins and vitamin C and things like that. So we do want to make sure that we don't take too high of a dose for too long. So that's just important to keep in mind as well. So that's why dosing can be a really important thing to take some time to figure out what the best amount is for you. But that's also why the best form is one that's emulsified in fat, because that really helps with absorption. So we really love one that's like a dropper, like that can be easy to take. Sometimes we have capsules if you're taking a higher dose. I would stay away from ones that are like crushed in hard tablets, because those ones aren't really emulsified in fat, so they're not as well absorbed. The other thing, we love injections, and so we also do injections. If you have your blood levels tested and you're quite deficient, then an injection can be a really more convenient way to get like a high dose, so you don't have to be taking as much all the time. So that's another form of vitamin D. So I think that was everything I wanted to cover. I hope that it was interesting. Like I hope to see kind of all the different benefits that vitamin D really has, like throughout our body. It's a really great nutrient to take. The dose is important. Maybe, we don't have as much sunshine today as we did yesterday, but maybe this will motivate you when the sun is shining to run outside and just put your face into the sun and to see how good that feels. So yeah, if you have any questions, I think that there's a chat box that we can respond to you guys later too, if we don't have time during this call.
So great, Dr. Keara. That was amazing. And wow, I have even more love for vitamin D3 listening to you talk about it.